If you came to see me as a patient and you said, Dr. Murray, I have a headache, do you think it could be brain cancer? Which patients often ask. I would say to you, if I knew you, you 30 years old, healthy, no reason, I would say probably not. I wouldn't say absolutely not because we don't know for sure unless we do tests. So when you go see your doctor or when we raise a question, what happens if we open up this high school? It's rare that we have scientific certainty. In fact, if someone tells you that something is 100% true, you almost certainly know that they don't know what they're talking about. So, one of the things we have to become, which we do in normal life, we have to become uncomfortable with uncertainty. That doesn't mean craziness, that just means uncertainty. So I can't guarantee you that your headache, which is probably just a headache because you stayed up late last night or because you didn't eat this morning, I can't guarantee you that it's not brain cancer, even though I may be 99.999% sure that it's not brain cancer. This is a problem that we have with this pandemic. So we're not able to guarantee for certain how many people are going to die tomorrow in Illinois. Unfortunately, I think over the next several days, the number of people that are going to die are going to go up. I don't know that for certain, but I'm pretty sure. Why? Because of the Thanksgiving holiday, and we expect cases to go up. So, one of the things that we have to learn how to do as public health people, and you all are now, whether you want to be or not, public health workers, we have to learn how to speak to people in plain English and how to communicate with them what we're sure about, what we're more confident of, and what we don't know about. Because when we tell people, and think about the pandemic, when we started off, we told people based on the best knowledge we had at that time that you didn't have to, the ordinary person didn't have to wear masks in the street. That's what we said. Now, if we said it like we knew it for sure, that was a mistake. And what happened is we learned more about this virus. We learned more about how it's spread. Technically, it's more spread. It's more of an air transmitted virus than droplet. But the details of that aren't important. So as we learned more, we changed our recommendations. And you can expect this to continue to happen with this pandemic as it evolves. So we may say one thing in December, we're going to encourage people to get vaccinated. But for example, I'll tell you right now, we don't know how long the vaccine, we said 95% of it, we don't know how long it lasts, how long the immunity lasts. It'd be great if it lasted a lifetime, but we don't know. So as we encourage people to get vaccinated, we need to say, this is what we know now. It's better to be vaccinated than not vaccinated, but we're not sure how long this vaccine is going to last, for example. So one of the tasks, I think the hardest task when you're working with people is just to speak the truth and don't overpromise. Don't pretend that we know more than we already know. But if you are used to working with people, helping them get unemployment, for example, or helping them get disability, you don't tell them up front, oh, for sure you're going to get disability, because you and I both know that's a tricky thing to really be clear about. So just remember that that same thing is true in this area. I don't care whether you have an MD after your name or whether you're just an experienced case manager and understand how long it takes to get something done.